So this video accompanies the article I wrote about the real reason your shoulder hurts, and it all has to do with poor leverage and poor design of the shoulder. So if this orange tape is your deltoid, and we're being kind of generous here, it doesn't have very good leverage and it's pretty short. And where it attaches here on your arm, it really has poor leverage. This is just the design of it. Now it's designed this way on purpose so that it has great mobility, okay? If we had better leverage and I was pulling on this rope, it would attach way down here. Then we'd have better leverage, but then of course we would look like this, right? And we wouldn't be able to reach all the way up over our head. So if I try and pull with this rope across here, and of course your deltoid doesn't do that. Your deltoid stops right here. The muscle shortens, okay? But when I try and pull this all the way across to try and lift it overhead, this is extremely difficult. We take this for granted when we could hold our arm out straight to the side. It's pretty ingenious. So the job of the rotator cuff is to keep this ball down and back in the socket so that it can rotate and clear this bony bridge and the ligaments, okay? And this is where your deltoid attaches, so that way you can raise your arm. But this has very poor leverage because of where it's located. The rotator cuff muscles are very small, and they help bring that ball down and back in the socket so you can clear this, and then you don't pinch one of the rotator cuff muscles, or that's what's called impingement, underneath this bridge, okay? So can you do lateral raises? Yes. Some people can do them without pain, but this is an extremely prevalent problem, and we see this in the industry over and over again. And the industry will band-aid all these problems. So, you know, you have tendonitis or bursitis, we might give you a shot, we can tape it, and that's another good article I have in video about relieving the symptoms, but we're not fixing the problem. And the problem is leverage, and we need to respect that design and leverage. So when you're working out, yes, you can do lateral raises, but that's not how you're going to function during the day. Even if you're painting, you're going to bend the elbow to create some better leverage. If you're a weightlifter, you can get away with doing lateral raises, but if you notice the heavy weightlifters, they slightly cheat, they bend the elbows slightly, so that way they can get a better contraction and they have better leverage, okay? So I see this many times in women's aerobics classes where, you know, you want the really nice delts, so you keep that arm straight. Now, will it build them up? Yes. But then there's a huge potential for impingement, tendonitis in here. So it doesn't always have to be done that way. Bodybuilders are able to do this with, you know, 40, 50 pounds of weight because they also do pull-ups, pull-downs, and rows. They do heavy, heavy amounts of exercise, and they have huge rotator cuff muscles, huge lats. All of that balances out this poor leverage. And you'll notice when there's an injured shoulder, they don't rotate, they elevate. So they have to cheat, and this hurts, and of course the leverage is even worse. So in therapy, can we treat the tendonitis and the bursitis? Yes. But it would be better if we understood this poor leverage and respected it when we're doing different activities. The industry will test you in a straight arm, front and back, and of course it's going to hurt because the leverage is so poor here. So I think it's important to recognize this poor leverage to make your problems go away. Otherwise, they're just going to come back over and over again, okay? Thanks for watching. Please subscribe, and please share all around. Thanks.